Via Zoom is a virologist at the KNUST, Dr. Michael Owusu. Doc, good to have you. What kind of face mask would you recommend for members of the public to wear?
Yeah, so there are three types of masks. We have the non-medical masks, which are the homemade ones, like the cloth that people put on. And we have the medical masks, which are mostly the surgical masks that are used in a hospital. And then we have the respirators, and these are ones that are able to filter small particles of microbial organisms. What is recommended for the public is the cloth mask. A cloth mask is good. It's been shown that it can prevent you from getting infections from between 2 up to 37% or whenever you are exposed to these viral particles. So it is good because, especially because of the pre-symptomatic and asymptomatic people who you may not know whether they have it or not. So at least if you have it, you keep it to yourself. And then if somebody doesn't have it, at least he can also be protected from getting it. It has been shown that people who practice this are able to reduce transmission of this virus in their community. And I think that is a good thing that we have to do. And I'm really encouraged and much happy that the secretary are going to ensure that this is done and this is adhered to within the communities.
Is this decision coming too late, would you say?
Well, I don't think it's too late. I think the announcement was made yesterday by the president, and they have been swift enough for this to be enforced. So
I'm just asking this, Dr. Michael Owusu, because we've recorded 5 more cases in that region, and I'm asking whether the decision to put on mask is coming in too late.
Well, I don't think it's too late. I think that maybe the clarification wasn't too clear at the beginning. So I'm happy that from today ongoing, the security are going to ensure that everybody puts this on. I think that it's a good thing. And once they ensure that people do this, many people are going to adhere to it. It's not too late. Let's practice this. And I'm sure once we do it, we become used to it. Many people will embrace it, and it will become a part of our normal culture to put on these face masks.
Well, back to the number of cases that have been recorded in Kumasi today. We know it's coming from some 204 samples that were tested. But is there any link to the lifting of the lockdown? Because a lot of people are beginning to say, yes, we said it. They've lifted the lockdown, and there are more cases being recorded.
I don't think this is linked to the lockdown. These samples, we have a lot of contact tracing samples backlogs that we are still analyzing. And for every batch that we analyze, there are some number of positives that we do get. This is not linked. I mean, every day cases come, and the number of cases that we are recording has been consistent over the past 2 weeks. I don't think this is as a result of the lifting. It's too early to really make any kind of conjecture or analysis on this. So for those who said that is due to the lifting of the lockdown, I don't agree. These are samples that have been collected even before the lockdown, which have been analyzed and for which results have been given to the Ashanti Regional Directorate.
Now, there are many who say that the local mask that is being produced with local fabrics is not good enough to protect people from contracting the virus. What do you say to this?
Well, I disagree. There are levels of protection. If those who are not in high-risk areas, I mean, like the health workers and those who take care of people at the intensive care unit, they need the respirators, which are high-level ones. The public should not compete for face masks with the health workers. This has to be strongly made. I mean, it has to be clear to everybody. When the public begin to go for what the hospital use, we are going to deprive the hospital sector of these masks, and that is not the way to go. This is why, quickly, a policy on the use of homemade nose masks is the best. It has about 30 to 40% protection, which is good. But I also think that it would be a very good thing for us if the Ministry of Health can come out with a prototype, and the Food and Drugs Board and Standards Board can come out with a policy on how this has to be made to guide many who are doing it. At least if you have a 2-layer of some fabric material with the cloth in front to give you some level of protection, I think this is good. So it's not too late. We could have some material prototype and make this public to all tailors for them to follow that standard in what they are doing. And I believe with time we can standardize this across board, and many will begin to use it to help the population from becoming infected.
I'm grateful for your time. Dr. Michael Owusu is a virologist with the KNUST, and he's been talking about the type of nose mask that is appropriate to prevent us from contracting the COVID-19.